Kerala recently reported India's first case of monkeypox in July. It was detected in a man who returned from UAE few days back. India's first COVID-19 case was also reported from Kerala. It was detected in a student who returned from China. She was studying at the Wuhan University. The state has already seen outbreaks of many diseases like chikungunya, Japanese encephalitis, West Nile encephalitis, dengue, H1N1, Nipah, anthrax and coronavirus, leading many to ask why has the state become a hotspot for viral attacks. So let's talk about it. When COVID-19 broke out in the country, it was Kerala that became the first state to detect the first case of COVID. As the state witnessed a rise in cases, it declared a public health emergency and took significant measures to combat the virus. Although Kerala's fight against the virus has been lauded for rigorous and targeted testing, containment, community support, and contact tracing, but the situation got out of hand when the virus started spreading throughout the country. According to the Kerala government, the state saw a total of 5.26 lakh deaths due to COVID-19. In September 2021, Kerala was also hit with the Nipah virus when the 12-year-old boy who contracted the disease died at a private hospital in Kozhikode. And now, monkeypox has been detected in a 35-year-old man in Kerala's Kollam city. But why only Kerala? Let's talk about the reasons why Kerala always becomes the first state to report any such cases. Reason number 1, spread of Keralites over the world. One of the main reasons why Kerala is vulnerable to virus attacks can be attributed to the fact that Keralites are spread all over the world. The state is well connected to the different parts of the world. According to the state government, around 40 lakh Keralites live outside the country. A large number of doctors and nurses from Kerala are working in different countries. There are students who take up medical courses abroad. And these categories face the occupational hazard of viral attacks. Reason number 2, human encroachment in the wildlife. The forests are being depleted and more land is being used by people for agriculture and habitat. Dr. T.S. Anish, Community Medical Chief of Thiruvananthapuram Medical College, in a report said that human expansion into forests of the Western Ghats and the reduction of fruits in the forest attract bats to human settlements in Kerala. These bats could be carrying various diseases, hence making outbreaks even more possible. Studies have also found the human expansion and more deforestation as the major cause for spread of the zoonotic diseases in Kerala. Reason number 3, good disease surveillance system. To track and detect the diseases timely, Kerala has one of the strongest surveillance systems in the country. It has an integrated disease surveillance project team, prevention of epidemics and infectious diseases cell, also state disease control and monitoring cell. This surveillance system is being put in place because of the past outbreaks and to timely control the spread of the disease. The monitoring happens daily and every viral infection is checked by the experts to detect any new viruses. So what's the solution to the problem? Experts have been advocating the adoption of a coordinated multidisciplinary One Health approach to effectively and efficiently tackle the global emergence and re-emergence of zoonotic diseases. The One Health approach calls for people from public health, animal health, and environment to check together to detect these diseases and contain them before they spread. One more thing that Kerala lacks currently is a biosafety level 3 lab to test the contagious viruses on time.